Good afternoon, students. We will go see about proximal femur fracture management, a comprehensive approach. The hip fractures primarily affecting the elderly patient is represent a significant public health challenges. And annually for over 3 lakhs people, the hip fracture occurs in the US, significantly impacting patients' independence and driving up the healthcare costs. Then you will go for proximal femur fractures management comprehensive approaches. The hip fractures primarily affecting the elderly represent a significant public health challenges. Annually, over the 3 lakhs of the hip fractures occur in the US, significantly impacting patient independence and driving up the healthcare cost. Then we'll go for epidemiology and impact. The incidence of the 90% of the incidence occurs in the 65 years old the patient. Then only the only mortality rate is the 14 to 36 percentage. That is a 1 year mortality. Rates of the post fracture highlight the severities. Then average cost is per patient in the first year alone $30,000. Then 50% of the functional recovery. Only half regain the pre-fracture status. Then these statistics underscore the profound impact of the proximal femur fracture on patient lives in the healthcare system. Then you go for diagnosis and classification. The clinical presentation, groin pain is the must complaint. Then external rotation and shortening of the limb is the present in the features. Then you will go for imaging, X-ray finding, mainly for anteroposterior view and then the cross table, lateral hip view and primary view. Then you'll go for MRI recommended for the occult fractures in the axis negative but suspicion high rate of the fractures. Then we'll go for surgical management options. Well, femoral neck fracture, non-displaced or minimally displaced, that is a internal fixation or cannulateral screw fixation done status. Then displaced fracture elderly is go for arthroplasty or hemiarthroplasty or total hip arthroplasty. Then displaced fracture younger will go for attempted for internal fixation for dynamic if screw fixation done. Then we'll go for intertrochanteric fracture. The stable is a dynamic if screw fixation. Then it's unstable, you will go for intramedullary nail or referred for better biomechanics. Then we'll go for subtrochanteric fractures. It will mainly for primarily treated with the intramedullary nailing. Then we'll go for post-operative care essential. The pain management, it's a multimodal analgesics for including regional block. Then the VT prophylaxis or oral anticoagulant for 30 days. Then early mobilization, you're out of the bed and weight bearing with the 24 to 48 hours. Then you'll go for delirium prevention, the frequent reorientation, adequate sleep, pain control. Then nutritional support, protein-rich diet for healing. Then vitamin or calcium supplementation is needed. Then go for rehabilitation protocol. Then acute phase, the inpatient focus on the early ambulation. Early ambulation is the main important. Basic transfers is important. Then pain control to initiate the recovery. Then we'll go for subacute phase is the outpatient. Progressive strengthening exercise must need. Then balance and gait training to rebuild the mobility and confidence. Then we'll go for long-term or home community. It's advanced functional exercise and fall prevention and strategies for sustained independence. Then we'll go for the ultimate goal is to regain independence in the activities of the daily living with the maximal functional recovery of the 6 to 12 month. Then we'll go for potential complication of the prevention is the early complications, the surgical site infection is the 2 to 5 percentage. Then VT is the thrombosis, varicose vein is the 5 to 10 percentage. Then pneumonia is the 10 to 15 percentage. Then cardiac event also 1. Then late complications mainly for non-union is the 5 to 15 percentage of the internal fixation. Then our avascular necrosis for femoral head up to 30% for the displaced femoral neck. Then malunion or implant failure. Then prevention strategies. Fall prevention program is a home safety assessment and targeted exercise for strength and balance. Then osteopathic management is a DEXA screening for at-risk groups and appropriate pharmacotherapy is a bypassmate. Then denosome. The nutrition support is adequate vitamin D or 800 to 1000 IU per day and calcium for 1200 milligram per day for usage of the nutritional support for the patient. Then conclusion of future direction, the multidisciplinary approaches for the requires coordinated team for the optimal patient outcomes. Then early intervention is crucial for reducing the complication and improving the recovery. Then you'll go for future advances are the protocol personalized medicines, advanced implant and the bone anabolic agents. Then aggressive rehabilitations key to restoring the functions and long-term quality of life. The focus is remain the improving patient outcome, enhancing their journey back to independence. These are the mainly focus on the future direction of the femoral fracture is the avoid the complications and improve the functional activities for the main goal of the patient need. Okay, thank you students.